Hey, I want to thank you guys for joining us tonight and spending the time to tune in here. First, my name is Eric Lewandowski. I'm a financial advisor in the Willistown area. I've been doing that for about 5 years. 5 years ago, I was playing baseball at Gannon University. I had a pretty severe injury in my back, and things haven't quite been the same since. And as part of rehabbing that brought me to meet Dr. Mike. Is even just last September, wasn't able to get out of bed for a month. I had 26. I wasn't even 26 yet. I was 25, and I was already on a full month short-term disability, kind of like a wake-up call there. Used to be able to get around, squat, deadlift 600 pounds. Some of that beat on my back, a couple bulged discs, and some arthritis in my shoulders, hips. Dr. Mike helped diagnose that and give some treatment. Combination of some things really helped, but one thing that really helped are the products that we're going to talk about today, and hopefully some of the stuff that Dr. Mike will go over can even shed a little bit of light, help someone listening here that the way it helped me, because it really changed my life. So without further ado, give you Dr. Mike.
Thanks, Eric. Can everybody see the screen? All right, and just see Marta.
Hello, everyone.
Hey there, Marta. We're gonna get started. If you don't mind, mute yourself by clicking the left lower corner.
Okay.
And then this way, I'll be able to talk without any distraction. If you find that button. Okay. I can mute you actually. I'll do it here. All right, good. All right, so a real quick disclaimer. Products information disclosed today do not intend to diagnose, treat, cure, or prevent any disease or medical condition. It is purely for educational purposes, and it's only to help it make an informed decision on how to improve your health. If you have any questions, please consult your physician. So we're going to play a quick video. Let's see what's going on here. This is not good. Give me 1 second here. Does that happen, Eric? If the link is no longer good.
Just there for a second.
Well, you see the screenshot. Let me see. Let me see if I can. All right, let me see if I can pull this up here. Give me a second here. I got it. We just gotta switch back and forth between that and YouTube, so. All right. That was kind of unexpected. All right, so we'll talk about this after the video.
What will your last 10 years look like? Will you be quick enough for a game of tag with your grandchild? Strong enough to embrace every moment? Will you grow old with vitality? Or get old with disease? It's time to decide.
All right, so we'll go back here. All right, can everybody see the screen still? All right, so we're gonna talk about pain that a lot of people suffer. And most of these pains really cause many, many issues as we continue to age as a population. So these are the top causes of chronic pain from WebMD. These are lower back pain, arthritis, most common osteoarthritis, headaches, multiple sclerosis, fibromyalgia, shingles, or nerve damage or neuropathy. So you or someone you know may be suffering from these And we're just going to talk about some of these problems and what we can do to help potentially. So according to the CDC, chronic pain is the #1 cause for medical care. In 2016, approximately 20.4% or 50 million US adults had chronic pain. This type of pain restricts mobility and daily activities, may lead to anxiety, depression, as well as dependence and addiction to opioids. And all this contributes to about $560 billion in direct medical costs, loss of productivity, and disability programs. So it's a very costly condition. Now we're going to talk about arthritis. It's the most common chronic conditions among habitual users of opioids in the United States. It's the #1 cause of disability among adults in this country. Women over 60 are 2 times more likely to have osteoarthritis than men. In 2013, over 100 million people affected and cost over $300 billion per year. And by 2050, approximately 150 million people worldwide will be impacted by osteoarthritis. And I know in this country, more and more baby boomers are reaching that age where, arthritis is definitely prevalent in pretty much everything they have in their body and everything they do in life. So what does that mean? If you have chronic pain or severe arthritis, which is inflammation in the joint, this potentially lead to some type of surgical intervention. And these are the top 5 orthopedic surgeries performed in the United States today: ACL reconstruction, knee replacement, shoulder replacement, hip replacement, and spinal surgery. Just want to point out, most of these things that are replaced are actually like a joint inside of in a shoulder or a knee, but you cannot really replace the spine. So, and more people actually have back-related problems I see, and you can't really replace that part of your body, unfortunately. At least not now. So these are the common treatment options before surgery: NSAIDs, over-the-counter, muscle relaxers, so opioids, chiropractic massage therapy, physical therapy, cortisone injection and pain management, and now nutraceuticals. So what are nutraceuticals? Products from food source with extra health benefits. Nutraceuticals are nutrients from nutritious food delivered in a pharmaceutical method. And this idea came from Hippocrates, who is the modern father of medicine, who said, "Let food be your medicine." So we're going to introduce you a line of nutraceuticals called isotonics. It's the world's most advanced nutraceuticals because it's a delivery system. It's actually a liquid formulation instead of a tablet. And this is really, readily absorbed by the body in a very fast manner. I'm going to tell you a little bit more about it.
It's a good video, Chris.
So isotonics is the world's most advanced nutraceuticals. Isotonics really means same tonicity, same pressure as your bodily fluids, such as blood, tears, sweat. And when you have this type of delivery method, it reduces the time for your body to absorb the nutrients once you take it on an empty stomach. So a typical tablet goes to your stomach, the acid is reduced, it takes time to actually break it down, and sometimes takes up to 4 hours. And because of the process, a lot of nutrients are actually lost during that digestion process. So you lost a lot of value. Isotonic is actually a powder. It does not require any type of binders, fillers, or any type of glue to hold together its shape. So, and the active ingredients in this product actually makes the product, taste great. As this process going through your bloodstream, it gets really delivered fast to everywhere in your body. And we always encourage everybody to follow the instructions on the bottle when you actually do take any type of nutritional supplements. But basically, you fill this up as indicated with either filter or bottled water, not tap water, and then drink first in the morning on an empty stomach. And that's it. So this is a snapshot of what happens when you take a regular type of, vitamin or tablet form in your stomach. You may not break down completely. And if you can tell, these are little remnants or residual effects of these tablets coursing through your whole entire GI tract. And then what happens is eventually, if it doesn't get broken down, it gets passed through your system and eventually down to the toilet. So isotonic solutions taken on an empty stomach, it bypasses the stomach, goes straight to the small intestine. and 95% nutrients are absorbed in the bloodstream really in 5 minutes. Isotonic formulation is the closest to an IV, and it's more cost effective than tablets. Now, why is that? So if you understand, most people, when they take any type of tablets, they don't have a good GI tract. They cannot break down the material, whatever it is. So if you take a tablet, maybe at best, you can only break down to about 25%, which means you might have to take 4 times the amount to actually get the same amount of nutrients absorbed in your body. So people who say, oh, I can buy something like that in Costco, or that, you probably can. But just remember, you're not getting the whole entire value absorbed in your system. So if they have to take 3 or 4 times the amount, I can tell you, it may not be the best value for them. Here's a quick video where Dr. Oz is explaining to her, Oprah Winfrey, what osteoporosis is. I'll play that right now.
So let's just
Hello,
take
Chris.
we often look at. This is what the spine looks like.
Wow.
And that's actually what a ridge that is in the meniscus of the spine. And in the middle, of course, is the pulp. Now, let me just take the spine and cut it in half and show you 2 people who have spines that are very different. This is a spine that I've cut in the field at. Okay? Oh, please.
I'm just taking it easy.
You can squeeze it, right?
Wow, it's like a rib.
Like a rib.
Yeah.
Now,
When you eat, yeah, rib.
that's a normal spine, like a normal rib.
Yeah.
What you'd expect to see
Well, that's a spine
in a restaurant
from a person.
for a person.
Okay.
Now, this
Ooh, no.
is the osteoporotic bone.
Oh.
Now, I want you to take this. I want everyone to see this. I want you to take it, and I want you to break it.
To break this?
Break it.
Okay. Whoa.
Didn't take much.
Wow.
Doesn't take much. This is what happens in osteoporosis. When we talk about getting frail,
Oh.
these little bone pieces here that make up the spinal column will collapse, giving you a hump, the dowager's hump.
Yeah.
That's why people get shorter and shorter and shorter as they move, and then they can't get the kind of fullness in life, and that's why you don't want to look like that. But it doesn't have to be, because this bone is from someone who's older than this one was from. So
Really?
you have that control if you take action.
Oh.
All right, so don't know if you heard that, but one of the things to help osteoporosis is buy something called calcium that everybody knows about. So what are the benefits of calcium? Maintains strong, healthy bones, teeth, and gums. It supports skeletal health, promotes normal regulations of enzymes and hormones, supports cardiovascular health, has additional benefits that reduces the risk of osteoporosis along with vitamin D, the healthy diet, and the physical activity, and also promotes normal contraction of skeletal and heart muscles. And believe it or not, calcium is also a natural muscle relaxer, believe it or not. So everybody knows about calcium, and most people get the calcium from where? Milk. Well, believe it or not, an 8-ounce glass of 2% milk only has about 295 grams. I'm going to show you that 7 foods down underneath have 7 more calciums than milk. These are firm tofu, salmon, oatmeal, sardines, chickpeas, ricotta cheese, and some type of dark leafy greens. So this is the isotonic calcium formulation we have here. This actually has 5 different kinds of calcium all in one capful of this isotonic solution. And it actually delivers up to 750 milligrams of calcium to your body. And if you break it down, it's only about a little bit more than a quarter per day for that. And that will help your bones get stronger as you get older, especially for a menopausal woman or anybody who has history of osteopenia or osteoporosis in their family. Now we're going to talk another important supplement or vitamin that goes with calcium. That's vitamin D. So this is a study published on PubMed that vitamin D is essential for bone health. Anybody who has been quarantined during this, COVID time, we don't get enough vitamin D outside from the sun. So therefore, people who are sitting more or they're sitting inside of a room, not getting outside to get the right necessary exposure, you're not getting enough vitamin D in general. Here's another study that says the role of vitamin D in maintaining bone health in older people is important. And I can tell you, older people, once they start taking vitamin D, it may be too late. So you can actually request your doctor to do a blood test to see what your vitamin D level is before you get old. So you can start doing something before it's too late. So the question is, are you deficient in vitamin D? Over 1 billion people worldwide have low levels of vitamin D. Now, this is based on an old study in 2011. 41% of U.S. adults are vitamin D deficient, and out of that, 82.1 of African Americans have low levels of vitamin D, and 69.2 of Hispanics have low levels of vitamin D. And this was published in 2018. 2020, I can tell you, if they do the same study, we should have higher levels of vitamin D deficiency in this country, maybe even worldwide because of quarantine. So this is the isotonic vitamin D with K2 that we have. Again, real quick, vitamin D increases bone density by supporting normal osteoclast activity, which means lays down the foundation of bones in your body. Women with osteoporosis, osteopenia often have low levels of vitamin D, as I said earlier. This also helps with healthy arteries, supports normal blood pressure, supports elasticity of blood vessels. And then really quick, what's the difference between vitamin K1 and K2? That's another vitamin that goes with vitamin D. Primarily, it's a chemical structure. And K1 is found primarily in your liver, but K2 is usually found in your bloodstream. So this one actually helps deliver vitamin D to your bones from the blood to help actually get the vitamin D and calcium into your bones to support it. Anybody who has any type of vitamin D that only has K1, you might interfere with the liver enzymes, whatnot. So, and this is what our isotonic vitamin D looks like in this formulation. It's a little pinkish solution here, and this is a vegan product. It has 5,000 IUs per serving, and he breaks it down to about $1.12 a day. And I'm going to introduce you to another product. This is called the Prime Joint Support Formula. This is usually for people who are over the age of 40, but if you have earlier signs of arthritis, this might also benefit you. This helps support and maintain optimal joint health and flexibility with 3 primary ingredients: glucosamine for healthy joint function and production of synovial fluid, which lubricates your joints and regenerates cartilage; pycnogenol, which is pine bark. This reduces inflammation from daily activities and from aging. Hyaluronic acid, this maintains strong, healthy cartilage and healing. So this product pretty much keeps your joints young and cushioned, and does not have what's called chondroitin. That's found a lot of the products out in the retail pharmacy, because this particular substance is very poorly absorbed. So this particular formulation doesn't have chondroitin. And I'm going to play a quick video promoted by 6-time NBA champion Chicago Bulls, and who played with Michael Jordan in the 90s, Scottie Pippen.
Ladies and gentlemen, please give a nice warm welcome to Scottie Pippen. We appreciate the fact you've been a brand ambassador for the Prime Joint Support Formula by Isotonic.
I just feel like the Prime Joint Support has just kept me active and kept my body with a lot of fluidity. And I stay pretty active, but I think it's been because the product has allowed me to continue with my day-to-day activity. And if anyone who is feeling the aches and pains, I mean, if you need some glucosamine, your joints are a little stiff, a little sore, go off for a run, hey, the product is for you. It's been a blessing for me to be able to have a product and have a family that, you know, I dearly love so much.
Okay, so this is what the actual product looks like. And this product has no detectable GMOs. And it's about $1.73 per serving per day. I had a 71-year-old patient who had problems moving around, and he used to be an avid bicyclist. So I introduced him to this product. After 1 month, he said he was riding about 10 miles a day. So we'll talk about that later on too. All right, I'm going to introduce another product. It's called OPC with pycnogenol, which is what's called pine bark. This particular product combats free radical. It's a very potent antioxidant. What is an antioxidant? Antioxidant is a substance that actually protects the cell from breaking down or from damage. So for example, if you actually cut open an apple, let it sit on a counter, about maybe 15, 20 minutes, the surface of the apple starts to turn brown. Well, that's from what? The oxygen in the air, or oxidative stress. So when we actually breathe in the air or drink the water, we also are inhaling or taking some of these toxins in our system. And over time, that actually kind of starts to drag down our system, or more specifically our blood. So anyway, this product actually helps with inflammation. It helps increases joint flexibility, supports healthy cholesterol level, promotes healthy circulation, supports cardiovascular health. It helps with normal blood glucose levels. So anybody who's diabetic, this can actually help them actually control their blood sugar. So this product alone helps with 5-6 different type of ailments listed on the screen, but it actually does so many more, which we won't discuss. So real quick, this is a snapshot of red blood cells under high power microscope of a person with chronic fatigue and physically disabled. So on the left, you see this picture of this blob of all these things, which on the right, you should see, there should be individual red blood cells. And after 30 days of taking this product, you can tell from going from globulated blood cells clumped together to now starting to form defined borders and actually separated. So if this is in motion, you can actually see the blood flowing the right way. This is another sample of someone who actually was exposed to toxic waste, chemical waste, who has severe joint pain and is wheelchair bound. As you can tell on the left, this person does not have well-defined red blood cells. Everything is pretty much, clumped together or destroyed. And then after taking this product for about 14 days, you can actually see regular cell walls starting to form regularly and is actually starting to go back to its normal shape. And I'm going to play another video here. This is Dr. Isidore Rosenfeld, who is a cardiologist and a clinical professor at Cornell University that talks about this product on Fox News.
Sundays, good morning. Sunday House Call host, Dr. Isidore Rosenfeld, the Rossi Distinguished Professor of Clinical Medicine at the Weill Cornell Medical Center, recipient of the United Nations Citizen of the World Award, and the best person to ask some of these great questions that we have today. Some of them are from you. Pine bark relieves your pain if you have it in the knee. Who knew?
Pine bark is marketed as pycnogenol. If you go to your health food store, you see pycnogenol. I think it's a great thing. I take it myself every morning. It contains bioflavonoids. It contains a lot of anti-inflammatory properties, and the most recent research shows that about 100 milligrams, 50 milligrams twice a day of pycnogenol, pine bark, relieves arthritis, and after you stop taking it, the relief lasts for, several weeks. That's very interesting. It's especially apparently effective for arthritis of the knee. But I have read reports in the last few months which indicate that pycnogenol may also be good for cognitive impairment for people.
Okay. So this is the actual product, OPC3 with pycnogenol, the most powerful antioxidant on the market today. These come in either 10-day serving size or a 45-day serving size. And if you look at the breakdown, it's definitely cheaper to get it in a bigger size than smaller. But if you look at all the products we talk about tonight in this formulation, it's about around $5 or so a day. And obviously, if you have pain or aches, think about how much you're spending on whether it's, prescription medication, or even if you don't have pain, what do you spend $5 on per day that's actually good for your body compared to what you spend on that's bad for your body? So these are just things that we want to show people what they can do to help themselves if they really are motivated to feel better. So here's a summary: how to achieve optimal joint health. Know your family history. Who has bad backs and knees? Because if you have family history of that, very likely you will have it sometime in your life. It's not a matter of, when. It's not a matter of if, it's a matter of when, okay? Avoid traumas and repetitive injuries to the joints. A healthy way will reduce pressure on your joints, have an active lifestyle, and exercise regularly. Drink plenty of water, take the right nutraceuticals, get plenty of rest to help the body recover and repair. And then finally, a quote from Benjamin Franklin: an ounce of prevention is worth a pound of cure. With that, I am done. So
Hey, thanks, Dr. Mike.
Sure.
Appreciate the presentation there.
You're welcome.
What?
So I'll have testimonials or questions. Anybody wants to say something, free, because we don't have a lot of people. So go right ahead if you have any questions or testimonials.
I was going to share mine real quick. Just shared a little bit of my story in the introduction there. And for me, I came to Dr. Mike trying everything over the one slide that really sticks out: over-the-counter drugs, change in diet, massage therapy, chiropractic, PT, all would help, but didn't really solve the problem. There was something missing. We even talked about cortisone injections, which is one of the ones right before Nutriceuticals, but we went, tried some of these products, and specifically the OPC3 and one that wasn't talked about, Maximum Orac, helped me. I can feel the inflammation going down, and I was even taking prescription drugs in September, muscle relaxers and painkillers just to get by for a whole month. And since, I haven't had to touch any of that. Need less chiropractic, need less PT, no over-the-counter medication since then. And I'm back to living healthy, active, more and more each week. And the biggest thing I notice is when I don't take it, honestly, because now I'm doing more things and it gets inflamed from but normal inflammation. So the products have been amazing to me. And I just thank you every time for even introducing them as a recommendation.
So you're 26 now, right, Eric?
Yep.
Right. So here's one question I always ask when somebody's in pain. Do you feel your age, or do you feel older than your age when you're in pain? It's always older, right?
Oh, yeah.
Yeah, so now you feel like your own age, if not younger, with these products. So that says a lot.
Yeah, I feel like that movie Benjamin Button lately.
Yeah, you're reversing your age. That's awesome. Some people can actually say that, right? Especially in today's, day and age. Anybody else?
Yeah, I could say some, Mike. I still think I'm 26, but I'm actually 74, and I feel the pain, and I've done the OPC3 for my arthritis, and then I've taken that's helped my arthritis a lot, I know, and I take the bone and joint stuff now also, which helps my knee problems and shoulder and all that stuff. But it works, and I can always tell when I go off it. That's when I can always tell that it's working, because when I go off it, I feel the pain.
Yeah, same for me. I have osteoporosis in my lower back, and I could not lay flat, and I have the pains, and it would be very uncomfortable. And now I can lay flat. I don't have that pain at night, and I'm really thrilled with the results.
Awesome. So I think the products definitely do what he says, and then obviously if you do what you're supposed to do, and then make sure you don't injure yourself the wrong way, then obviously you can use your body to its full potential. So, well, that's pretty much it, ladies and gentlemen.
Any questions, anybody?
Oh, okay. Well, get back to the person who invited you if you have any interest to learn more about the product or whatnot, or even maybe get a sample of it. And then hopefully everybody can stay safe and healthy for the rest of the year and have a great summer and a great evening.